Audio. My name is Heather Lloyd, and I am with the organization called NAMI, National Alliance on Mental Illness, which is the largest, nation's largest grassroots mental health organization. And I am a member of the board and a program leader here in the Columbia County affiliate of NAMI. We are a nonprofit organization that is committed to building better lives and ensuring dignity and respect for those affected by mental illness through support, education, and advocacy. This includes those diagnosed with a mental illness, their family members, their friends, mental health professionals, and educators. We work collaboratively with our county and state and national organizations and with other stakeholders to educate the public, to advocate for legislation, to reduce stigma and improve the mental health system. And thanks everyone for coming. Our speaker tonight is Carl Castagna. Carl is a Kinderhook resident. We are in Kinderhook for those of you who are online. He is a psychotherapist in private practice specializing in addiction treatment, family therapy, and professional interventions. With a career spanning 5 decades, Carl has served at St. Vincent's Hospital, Beth Israel Medical Center, Cornell University Medical College, and New York Hospital, where he founded the Midtown Center for Treatment and Research. He is now clinical director at New York Center for Living. Carl combines clinical expertise with personal insight from 35 years of sobriety. Congratulations. He combines these things to help families navigate the path to recovery. So this is a hybrid meeting. We have people who are online and in the room here. We've muted microphones. We ask you to keep them muted during the presentation. We'll open up for Q&A afterwards. For those of you who are lucky enough to be in the room, help yourself to snacks over there, snacks and drinks. Robert, who is with NAMI, and I will be at the tables afterwards for questions about anything. And finally, the library closes at 8, so we're going to be respectful of that. So please welcome Carl. Thank you.
Thank you so much. Thank you very much. Thank you for coming. Thank you for watching on Zoom. So tonight we're going to talk about a family intervention. We're going to talk about what enabling behavior is. We're going to talk about the disease of addiction, chemical dependency. We're going to talk about how to motivate a loved one into treatment with compassion and love. So I'm going to jump around. I'm not a lecturer. I haven't lectured in probably about 25 years. So this is my first shot in a while. I hope you'll bear with me. And of course, Heather said, you have a deck. And I brought it. I have all of my notes here. That's as sophisticated as I get when it comes to these things. So first, let me just start with a breathing exercise. Okay, so I think that certainly looking ahead at an intervention, it's going to challenge us in many ways. And I want to really let you know how much I respect the fact that you're watching, that some of you have come here today. It's an anxiety-producing situation. And I think that we want to be able to kind of reduce as much stress as possible. So I'm going to start off teaching you something. Just I'm going to go through it a couple of times. I'm going to try to relax myself a little, and help. Hopefully, you'll join me on the second or third time around. So I'm going to suck a deep breath in. I'm going to force more in. I'm going to blow half out, full out, and I'm going to force more out. And then I'm going to breathe normal. So I'm going to do 1 or 2 more times, and maybe if you want to join in. I'm going to suck a deep breath in, force more in, half out, full out, force more out, and breathe normal. All right, if you want to join me, suck a deep breath in, force more in, half out, full out. Force more out. And breathe normally. One more time. Just suck a deep breath in. Force more in. Half out. Pull out. Force more out. And breathe normally. So right now I feel a little lightheaded. I feel a lot more relaxed. The noise in the room, the ambient noise in the room sounds different to me. I feel like I'm in a bit of an altered state right now. And I think that for someone who has mental illness like me, I've been diagnosed with a generalized anxiety disorder and was fortunate enough to work at St. Vincent's Hospital, which was a teaching hospital at the beginning of my career, and realized that if I was going to stay in the field any longer, then I better get my own head together. So at the age of 20, making about $10,000 a year, I spent most of that money on psychoanalysis. So I was on the couch for 10 years. Doesn't mean I'm at the zenith of mental health after having spent all that money and time, but I really got a sense of who I was and who I wasn't and what was going on in my head. And at that time, it was the Vietnam War, and drugs were rampant there. And if you worked in a hospital, let's say, and you were friends with the doctors, who would bring the booze to the party, who would bring the food to the party, and who's going to bring the drugs to the party. And the doctors wrote the scripts, and we went to the drugstore and we got the meds. Okay, and the meds worked. So early on, feeling anxious, the Vietnam War, I'm about to go into war and die on the battlefield, did not want to be alive, history of depression, bipolar disease in the family. Father suicided when I was 5. He was hospitalized via an intervention, by the way. Uncle came over to the house. He was paranoid because there was a bomb in my grandmother's basement, and they wanted him to, take him to the hospital, and he ran away. So they ran after him, and they caught up to him, and eventually they hospitalized him. So there, in the hospital for 6 months. Back in the day, when medication was really not developed for bipolar disease, I'm not even sure if they knew what that was. They kept people in the hospital for a long time. Now, unfortunately, they didn't do much for him, and he was a man who was kind of a man on fire. And he never cursed a day in his life. Was very, very quiet, very intelligent. Was an artist, a musician, but he kept things in. And they built up. And unfortunately, on the day he came home for a weekend pass, he took me up to the roof and he said, "Never go near the edge." And he took me back down to my mom, went out for a pack of cigarettes, and that was the end of Dad. 15 minutes later, there was a knock at the door. My mother went into shock and my sister passed out. EMS was there. 2 hours later, I became the man in the family. The wisdom of my loving uncles said, "You're now the man in the family. Please take care of your mother and your sister." My sister being, 11 years my senior. I didn't know what happened at the time. I found out the next day. I was at grandma's house and I overheard my mom speaking with my grandfather, and he was motioning over a chair like this. And he must have been saying, he must have leaned over and fell. That's when I knew something was going on. And they realized that I was on the staircase. My mom brought me upstairs, and it was like, Daddy's never coming home, and Daddy is in heaven. And that was the beginning of my trauma. It was the beginning of my anxiety disorder. Lucky thing that I had a loving mother who gave me everything, the attention that I needed. But then it was time to go to nursery school about 2 weeks later. And I then had, an attachment situation going on there and was afraid to detach from Mom. And I thought, well, who is going to take care of this 5-year-old child if she dies while I'm in school? So it went on and on and on and on from there. So you can imagine then growing up and eventually getting into my teenage years, how easy it would be to have the trauma and the anxiety allayed and sedated by doing what all the other kids were doing. So we would drink, we would drug, we would do this and that, and the other thing. And I thought to myself, you know what? I didn't really want to be alive. It's the Vietnam War. I'm going to be dead anyway on the battlefield, but maybe I'll postpone killing myself and see how it goes while I could sedate myself with all of these drugs and alcohol. And it worked pretty well. It worked pretty well, but I became, pretty much dependent on that, because using these drugs anesthetizes your conscience. The reason why I'm telling you all of this is because it's so easy to fall into chemical dependency. You're here and we're thinking about, intervening on a loved one, and you must be thinking like, it's supposed to be a loving intervention, but my loved one does such god-awful, engages in such god-awful behavior. I'm so angry and disappointed. And you know what? They never apologize. And something to know about chemical dependency, particularly alcoholism, is that people have blackouts. Memory blackouts are when your brain does not print into memory what you're experiencing. So I've worked with pilots who've safely flown jets, landed at airports, had no recollection that they had the flight, that they went to the flight. They seemed perfectly, this is back in the 70s when this was unfortunately, pretty commonplace. But that's a blackout. Now, a blackout could be as outrageous as that, but a blackout could be just not remembering a portion of a conversation that I had with a loved one the night before. It could last a couple of days. Okay, but if I don't realize that I had atrocious behavior, how am I going to apologize? And if I live with someone that I should have apologized to, but I didn't, they're going to get very upset. They're going to think, I'm not a good person. And, and this is going on and on and on and on. So what I want to say is that the behavior that you're seeing your loved one exhibit is drug-induced behavior. Their conscience is anesthetized. They're under anesthesia. And if you went to a hospital and the anesthesiologist started to, pump propofol into you before your operation, and the doctor said, you know what, you have a nice Porsche in the driveway. I'd really like you to would you mind if I could use it for the weekend? And I'm like, sure, doc, whatever you need. And if you don't make it through the operation, would you want, can I keep right? I would not have been of sound mind to make that promise to the doctor because I'm under anesthesia. So that's blatantly obvious. But our loved ones are under anesthesia all the time, sedated by a pretty powerful drug called ethyl alcohol. They may be taking, sedative pills like Ativan. Ativan is a sedative class drug. In fact, Ativan is what they use if you go into the hospital, you need to be detoxified. They wean you off the alcohol by giving you the Ativan. So they want to step down slowly, but some genius doctors in their infinite wisdom, who are not particularly trained in this field, will say to the patient, pull back on your alcohol, take some Ativan, okay? Titrate down on the alcohol, bring up the Ativan, so you don't want to be shaking, okay? But then you can wean yourself off the alcohol. Now, maybe that's true. I doubt that really happens, because really what happens is that the alcoholic realizes that Ativan doesn't smell. If I'm going to go to work in the morning and I'm a doctor, no one's going to want me to put a scalpel in my hand. And I treat doctors, and I treated surgeons, and I treated anesthesiologists, some of whom went to school just so they could get these drugs, right? That's an issue. So the Ativan doesn't smell. I'm not shaky in the morning. I could perform because I better make that incision pretty straight. or else I'm going to be out of private practice in no time, and I'm going to be in jail. So that's what happens to some people. Okay, they get off of the alcohol onto the Ativan, or better yet, they could drink at night, take the Ativan during the day. And then the combination of the two is a really nice buzz. It's a really nice buzz. But then, you know, they're going to drink or drive, and their judgment is going to be impaired. And what I'm saying is that it is not willful misconduct, that the brain changes. It actually changes. They could see on MRIs and CAT scans and all of this kind of stuff, PET scans, they could see the changes in the brain. And I just heard Dr. Amen, I think it's Daniel Amen. He's a brain guy, you know, at Harvard, I believe. And he studies the brain. And he says you could see the changes in these young kids who are smoking weed, you know what I mean, and drinking alcohol. You can actually see that they have old brains. And these kids are 14, 15, 16 years old. They have old brains. I saw something on, I think, Tucker Carlson interviewed Eamon, and someone sent it to me recently. So it's not willful misconduct. What your loved one is doing is out of their control. They've lost control over their use of alcohol and drugs. They cannot cut back. And a lot of times, you know, we ask, well, why don't you just cut back? You're drinking too much. Why don't you cut back? That's a problem. That's a problem. So here are my sophisticated sheets here. Let's just say I don't drink for 6 months. I'm going to call that baseline. I'm going to call that my baseline. Okay. Up here is agitation. Down here is sedation. If I take a drug like ethyl alcohol, this is -1, -2, -3 towards sedation. 1, 2, 3, 4, 5 toward agitation up there. If I take a drink, it's a sedative drug. So one drink, I'm going to go down. Okay. If I wait 2 hours, it's going to rise back up to the start point, except it's going to overshoot the start point just by a little. If I take another drink, it's going to go back down again. Except it's not going to get down as low as the initial one because it started from a higher point. So what I actually did in that shaded area is that I sedated my central nervous system. I felt good. It wore off within an hour or two. I then created anxiety, agitation that didn't exist before. So I wait a couple hours, it wears off, it springs up like a spring, but it's a slow motion spring. What am I going to do? Take another drink. Night is young. Okay. And you realize that as it goes up, it can't come equally down. It doesn't resolve at the start point. Okay. It now springs up into agitation. Right? So my fourth drink, after I wait, gets me back to the baseline. And that's not where I want to be after I was out on a club, you know, spending, you know, hundreds of dollars in bottle service, right? I don't want to spend all of that money, $500 on the bottle that cost $80 in the store and be at my baseline. So what do? Genius. This is genius. You don't wait an hour or two in between. You get the sedation, you don't wait till the agitation rises over 2 hours, and then you got to come back down again. You compress it. Now this is gonna rebound. So what do? Bartender, back them up. You keep drinking because you want to be down there. There's where you're kind of mellow and you want to be. Problem is, you're not going to stay mellow for too long because you got this rebound agitation. So it's going to rebound. You back them up, you have another drink, bring it back down again. You're going to wait only 15 minutes. It's still going to rebound up, but you're going to follow up with another drink and you're going to bring it down again. Okay. And then it's going to rebound and you're going to keep it there. So you're going to spend the night in that area. That's the mellow zone. That's where you want to be. That's the sweet spot. What happens is that you go home and you try to go to bed, which is going to be very easy because you're drunk out of your mind. What happens is that agitation level that you would have paid off incrementally along the way, waiting 2 hours in between drinks, that agitation level is now going to rise. So at 5 o'clock in the morning, you're wide awake. Rebound agitation. Well, what do you do when you're wide awake at 5 o'clock in the morning? Go to the gym? No. You take another drink. And you want to get this back down, at least to the baseline. Okay? Sleep a couple hours, rebound agitation. Wake up. Over here. Now I'm shaking. Now I have tremors. That's a rebound agitation. That's a withdrawal sign from a sedative drug called ethyl alcohol. I'm shaking. What's going to get rid of the shakes? Ativan, Valium, Librium, alcohol. Ready available alcohol. Socially accepted alcohol. It's not socially accepted in the morning. So I'll put it in my tea or a hot toddy or a little Anzet or Sambuca in my espresso, and I'll chew gum or have a mint or something like that. Now, if you ever go near, like I used to live in Westchester, and go to Metro North, and you see that some of the bars near the train stations are open very early in the morning. And I always wondered, well, who are they serving? Like, who's going to the bar early in the morning? Now, I'm sure they serve eggs and stuff like that, but I don't think people are there for the eggs. All right, so you get on Metro North. I don't know what time the bar car, opens, but they're there nursing that withdrawal here. Now, I'm saying, problem with that is that if you stop, and we always tell them, why don't you cut back? If you cut back, the agitation level continues to rise. Now, it rises so high that your blood pressure is now off the charts at this point. You have to medicate that. If you don't medicate that, you're in big trouble. So people medicate it. Now, if you try to stop drinking on your own, and a lot of people do this because they're ashamed, they're ashamed to ask for help, and they try to cut back on their own. Except they fight this, they run into all of this agitation, right? And they think that that's what getting sober means, that they're going to have to remain in that level of agitation constantly. And they're thinking like, well, if that's what sobriety is, that's not for me. That's absolutely not for me. So what do? They hide it. They may go to their doctors and get a prescription. They may go online and try to get drugs online, which is very easy to do these days. Except, the drug dealers are very sophisticated at how to make money. So they have what's called a pill press. So they'll give you an Ativan that looks like an Ativan, except they'll cut it with whatever they can cut it with that'll sedate you like an Ativan. And oftentimes, we're getting opiates in there. We're getting fentanyl in there. And as you know, you've heard, in the news, and this is how people are overdosing. They didn't intend to overdose. They weren't suicidal. They were just trying to feel better or get rid of a pain syndrome or something like that. They took the drug. They're trying to get rid of the shakes. They're afraid to reach for help. And it's a predicament. So let me just finish with this. As this rises, if you don't medicate it, it goes off the chart. It takes 72 hours. It rises for 72 hours. And then it falls off and it comes back down to baseline. So from the point of your last drink to the point of where you're not shaking anymore. 72 hours at the height, it comes down, and it takes 5 days from the last drink to get back to the baseline. So what people have to do during that time, because that when you're up that high, your blood pressure is shooting up. You can have hallucinations. Back in the day, we used to call them delirium tremens, the DTs, pink elephants, and all of the stuff that we used to talk about back in the 70s. You can hallucinate. You could have a seizure, an epileptic type convulsion. And this is different than opiates. You know, opiate withdrawal, you could stop yourself on your own, roll around in incredible pain, incredible diarrhea. You're vomiting profusely for about 7 days. It's inhumane to do that, but we used to call it going cold turkey. But you're not going to die. If you try to do this with alcohol, because it's a sedative drug, and the effect on the brain, you could die. And people have gone into the DTs. I think the stats were 10% of people who went into the DTs got to the hospital, died in the hospital. They couldn't save them. Died as a result of that kind of level of hyperagitation, because your brain is frying at that point. So when you think about how come my loved one just doesn't stop drinking, they're caught in a trap. They can't, they're scared to death. And rightfully so, because this is what is going to happen. Now, it's a progressive disease, so this doesn't happen right off the bat. You know, it takes time to build up to physical dependency. Not everybody gets physically dependent and shakes. There may be people who have high tolerances, and that's part of, you know, what addiction is. It's why we call it a disease, because a disease is broken down to causative factors, progressive course, and if you do not treat it or ineffectively treat it, it will progress until death. It's a chronic disease. It will progress until death. So you go stage 1, 2, 3, 4, dead if left ineffectively treated, right? There are changes in the brain that create a launch sequence that once, particularly for people who are predisposed, so if you have a family history of alcoholism, you're going to be 4 to 5 times more likely to, if you experiment with alcohol over a period of time, to get caught in that trap where you're doomed, you know, you're damned if you do and damned if you don't. It works for a while. Most people think they're not alcoholic. You know why? Because they just don't stop drinking. So if they don't see this, they feel it at some point. They intuitively know when it's time to drink. It's telling me to shut up, this thing. So intuitively, they know when it's time to drink. Now, the problem is, of course, when it's time to drink may not coincide with what the social norms are. So it may be time to drink in the morning, maybe time to drink at noon time, and maybe time to drink, you know, at 4 o'clock, right before you have a big business meeting. So it's going to happen at inopportune times, but someone who is caught in that trap knows that they better medicate. And if they're going to get caught in that trap, they may have, you know, pills on hand to mitigate the withdrawal and all of that. So we get very sophisticated about how to do that. And then we know how to get to the wrong doctors, because doctors, even today, this was true 50 years ago when I came into the field, that doctors got 4 hours of experience and education in alcoholism and drug addiction, 4 hours in medical school. Pretty pathetic. Now, I was at a conference 7 years ago. Guy said the same thing. Went to talk to doctors who were just getting out of medical school and all again. The same thing, if they got 8 hours. Now, stats are in the ER or hospital admissions that 25 to 50% of hospital admissions are related to alcohol and drug usage, whether it be high blood pressure, you know, liver disease, heart disease, all the kidney problems. Everything that alcohol runs through, and every organ system in the body is agitated by alcohol. The brain gets fried, and every organ system gets fried.
Excuse me, what was that stat again?
I'm sorry?
Well, percentage-wise?
25 to 50% of all hospital admissions. We'll give you a couple more stats, and then we'll get more into why we're here today. Okay, so from the CDC, well, there's a couple of different things. Okay, so 1 in 5 adults have been sexually molested as a child. From the CDC. 1 in 4 was beaten by a parent to the point where a mark was left. 1 in 3 couples engage in physical violence. 25% of us grew up with alcoholic relatives. Now, those relatives weren't raising their hand, but we could reverse engineer and take a book, a look back and say, like, grandma lived to 102 and she drank scotch every day. Plus, she drank filterless Camels. She smoked filterless Camels, but she lived to 102. So she couldn't have been an alcoholic. And dad was a loving soul and a blah, 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 and a good wage earner. And, and he drank. And yes, I remember him, asking me to bring a beer and the blah, blah, blah. When we went to play baseball games, dad was not around. He was asleep and blah, blah, blah. But he was a great guy, but he couldn't have been alcoholic. And dad was not going to wave his hand. Neither was mom, because women aren't really alcoholic. Right? So 1 in 3, 20% of us grew up with alcohol relatives. 1 out of 8 of us have witnessed our mother being beaten. So you wonder, do these stats relate to drug addicted, souls who are helpless and powerless to do the right thing, but they're addicted and enslaved by a chemical handcuffs like alcohol and other drugs? Isn't that what you suppose that's at least connected? Someone else said, a species wired for survival, we have an odd habit of getting hooked on things that'll kill us. So in 2024, 80,000 Americans died of a drug overdose, 220 people per day. Approximately 20 to 30% of people who are prescribed opiates for chronic pain wind up misusing those opiates. 48 million Americans ages 12 and older had some type of substance use disorder in 2023. Among them, 7.5 million battled both with alcohol and drug disorders. Look at behavioral addiction, sex, online gambling, pornography, shopping, food. Brain scans of problem gamblers show that the same regions in the brain that light up under similar situations that persons addicted to drugs and alcohol do. It's a cycle of craving, binge, remorse, repeat. So it's not only that the chemical that we put in our body responds that way, but if we're watching pornography and the endorphins in our brain are really kicking with this aberrant, outrageous, over-the-top behavior. Rinse and repeat, rinse and repeat, rinse and repeat, okay? The same places light up in the brain. So people are addicted to pornography. The gambling is one of the worst. With drugs, you can only take so much before you overdose. But with gambling, you can double down. So I've had people who $250,000 down. Wife thinks they're saving up for a house. When it gets time to find the right house and you think like, hey, we can put like 500 grand down, there's nothing in the bank because the guy owed 250, doubled down, now he owes 500, there's nothing in the bank. So, and that could go on and on and on. And you see how seductive that is. So you're $500,000 down, and in one instance, you could make a bet and wipe out 500 grand. What? It's too seductive. And if you have that mechanism for addiction where it's kind of like, hey, why not? I really can't compute the consequences of my behavior, because what kicks in then are defense mechanisms that help me deny or project. It's my wife, who's a pain in the ass. She wants a big house, and what the hell? We don't live that way. I was born in the projects. Why don't she want a big house? Now, meanwhile, I wanted the big house, so I have the big house. It wasn't my wife. I'm the high maintenance guy. It's not my website. So, but we find all sorts of excuses to justify why we're doing what we're doing, because we really don't know why we're doing what we're doing. We're out of control. We've lost control. This is a brain disease. It makes decisions for us before we even wake up. So if I'm gonna wake up shaking, what's the first thing that I'm gonna do? Get on the treadmill? That ain't gonna happen. That's not gonna happen. So we have that going on. So some signs of addiction. Well, I'll tell you this. So esophageal varices. The veins in the throat burst because I poured so much alcohol down. Alcohol is an adjutant. So I've ruptured all over time, all of the veins in my esophagus can rupture. What happens? Person has a bleed out. So they start bleeding profusely. The blood comes, and they're on the floor. And if no one comes in to find them quick enough, they're out. Like, we're out of gas. We're out of blood. We're done. So I've had people who have had one bleed out only to survive, to go back into denial and think like, hey, I'm going to drink again. Come on now. I'm not going to give it up totally, but I'll never drink the way I used to because I just had a bleed out. I have to be out of my damn mind to do that again. I'm not crazy. Only to rinse and repeat and say, I'm going to stay away from the hard liquor. I'm just going to go with the wine. Only to have another bleed out, be fortunate enough to get rescued, stop. Wife is gonna, packing her bags and this, that, and honey, I'm telling you, I said, blah, blah, blah. So stays abstinent for a period of time, doesn't get sober. Abstinent is a whole different thing. We want people to get treatment, and we don't want to dry drunk. We want them to change their lifestyle and change their mindset and understand and get the education and go to rehab. Anyway, only to rinse and repeat again. Third, bleed out. Family calls me. It took the chief of police to get me in the door. This guy did not want to, he did not, and he had a girl that was living with him. She was profiting by staying with him. She had no place to live, and he had some money, and it was a beautiful thing for her. She was protecting herself from having this guy taken out of the house. She wouldn't answer the door. They wouldn't answer the door. Had to pull the chief of police 15 years ago. Right, chief of police comes and says, like, you know what, you better let Carl in because he's gonna call EMS and it's gonna be out all over the airwaves because this is life and death kind of stuff. So 4 hours later, in to the hospital, and this guy got sober. Okay, esophageal varices. That's the power of the denial, to have 3 bleed outs and think that you could rinse and repeat. The insanity that AA talks about, power greater ourselves can restore us to sanity. They're talking about what Einstein said is that you do the same thing over and over again and expect different outcome. This is a form of insanity. Now, if you put, now, I don't know if this is accurate, but I would bet my life, if you put someone on a lie detector test and you ask them, are you truly alcoholic after having all of this kind of stuff? And they would say, no, I am not. It's my bitch wife, it's my this, that, it's my boom, 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 right? And the lie detector would say, guy's telling the truth. He's not alcoholic. Because the mind changes. Right? Defenses kick in, erases the reality. And here I am, rinse and repeat, yet one more time. Okay, portable shunt. You don't hear that talk anymore. So I'm 20 years old, St. Vincent's Hospital, blah, blah, blah. You know, Skid Row, alcoholic, on the Bowery. Now, the Bowery, I can't afford to live on the Bowery. Not anymore, okay? But in the 70s, you know what I mean? My patients at St. Vincent's Hospital, which is on 12th Street, they were not that far from the Bowery, and my guys will come in and say, like, Carl, I got it okay. I have a box. It's in a hallway where there's a heater. That poor guy in the day room, he lives outside in a box. This guy was on the medical side of the hospital because his liver was about to just click out. They couldn't give him a liver transplant because you're not going to give somebody a liver transplant who's drinking, you know, bottles of wine a day on the Bowery. So they did this portable shunt that's kind of some kind of, I don't know, for lack of, like a neoprene hose, you know, replacement for a liver. I'm not a medical person, so I can't do justice. He's in the hospital for like 3 months. switched over to our rehab, and on the way down in the elevator, 20, he says to me, Carl, don't you worry about me. I'm just going to drink wine. He says, no more Mad Dog. It was Mad Dog 2020. What's the price? 30 twice or something like that back in the day. I'm just going to drink wine, he says. One more time, and then I'm going to get to the intervention. Guy smokes. Eventually, smokes enough to have throat cancer. They cut out his jaw to save his life. So he's got no jaw, except back in the day, there were wards. So I'm doing a bedside consultation over here, and these guys are 6 guys huddled in the bed over there, and then one gets a match, the other one gets a cigarette, they light it up, and they're passing it around like they're smoking a joint. Going around in a circle. I went over to them, there's oxygen in the room. They took the cigarette, because they have no jaw, they have no lips, put the cigarette in the tray hole. Talk about sepsis and all that kind of stuff. So, in tray hole, to tray hole, to tray hole, to tray hole, and they're passing around cigarette, okay? And I said, that's addiction. Never mind, poor guy, poor Barry, alcoholic. I've not seen anything like it since. The power of addiction. And these guys that went to Barry, they didn't start there. They were college professors and business people, and they deteriorated over time. Their wives threw them out, lost their families, all of it, and they deteriorated. It's progressive disease, on and on to the point where nobody cared anymore. It's like, we can't save this guy. How the hell are we going to save this guy? We got to move on. That is dead to us. We don't even want to. All right. So, with an intervention, it's a loving presentation. You want to come together. If you could get an professional interventionist, I would suggest it. Okay, interventions could get hairy sometimes, particularly if co-occurring disorders. If someone has an anxiety disorder, if they have a history of suicidal ideation, if they have a history of suicidal attempts, if they're on psychiatric medication, if they've been violent in the past. The shock of an intervention for some people is just so overwhelming to the client at the time that a loved one may not be able to manage that situation. So you would want to be careful about that. You would want to know, are there other drugs involved? Is there cocaine involved? All of that. It's been told that somebody who's on so much cocaine and their heart is beating, so they could be shot and still come at you because they're so ramped up, they're so revved up. So you want to know that first. So if you could get to an interventionist, get some information that maybe you could ask around at your church or your synagogue or at some AA meetings, if there are people in recovery that would do and help with an intervention, you would be best served by getting some assistance. Okay, if you could get a professional in to give you advice. So, person comes in, gives me a call, and says, "Hey, I have a loved one," or the hospital calls me up and says, "Hey, this family wants to get their loved one in, but they're refusing." How do we do it? Okay, so one family member calls the interventionist and says, "Hey, this is the situation." Family member comes in, meets with the interventionist, and gives the story, gives some of the background story, and says, "Okay, he's using alcohol." And we go through the list. And how much is he using? Does he have shakes and withdrawal? Has he ever been in treatment before? All of this kind of thing. What kind of impact is it having on the family? What kind of impact is it having on his job? Has he ever been arrested? Are there legal issues? Does he drink and drive? All of this kind of thing. So we take a bit of a look and we go through the symptoms, signs and symptoms, and we say, okay, yes, he has alcohol use disorder, he has cocaine use disorder, and yes, it's right that you came in, and he is resistant to getting help. I've asked him before. So then we take a look at, okay, who has been witness to the downward spiral of your loved one's usage? Okay, family members, co-workers, relatives, and we get a feel for who might be appropriate to come and talk about all of this stuff. unbeknownst to the patient, right? Because we want to keep the patient in the dark. We don't want to alert the patient because they're going to flee. Once they know something's up and they can sense it, they just know how to sense these things. We get some people in, we sit down around the table, and I ask, okay, what have you observed? You know, so DWI, we work together. He didn't show up at business meetings. He fell asleep during lunch the other day. It was very embarrassing and problematic. And you know, our business partners, you know what I mean, had concerns about it. He's a doctor, and you know what I mean, complaints have been made, this, that, and the other thing. So we try to get a sense of the symptom picture, and everybody kind of writes down all of this kind of stuff. And then what I asked them to do for homework is to describe in as much detail as possible, like 10 examples. So one by one, and then they do their homework. What did he look like? What did he act like? What day was this? Was it New Year's Eve? Was it Christmas Day? You know, blah, blah, blah. And everybody does their homework and puts a script together. And eventually, you know what I mean, they'll email in to me and we'll go over it and we'll tighten it up and all this kind of stuff. And then I ask them to come in, let's do a dress rehearsal of how to present that information, right? In a loving way, maintain eye contact, you know what I mean? Start off by saying, I love you. You know what I mean? I would do anything for you. Over the years, you know, I've seen your drinking become progressively worse. We've spoken about it. I've looked the other way for as long as I can. It's taken a toll on the children. It's taken a toll on you physically, and all of this. And that's why we're all here today. So one by one, we go around the room and we present and we look at each other and they face to face and they try to reenact, you know what I mean, what the scene will be like when you have the actual intervention. Put that together. While we're doing that, we're thinking about where should this person go? Do they need detoxification? Right? So do they need to be medically supervised? And if we're going to ask them to come off of the drugs, they're going to need medical supervision because they're going to be shaky. So generally from alcohol, you'll ask all of those questions about, you know, physical withdrawal and all of this kind of thing. Is he high bottles? Is he shaking in the morning? Is he diaphoretic? That means sweat in the middle of the night because your temperature is going up. You're in withdrawal. Your brain is starting to fry in withdrawal, and you know the sheets are profusely wet in the morning. That's a telltale sign that you're going through, you know, physical withdrawal. Put all that information together. Start to think about, okay, well, should it be, you know, rehab? Do they need detox first? Is there a rehab that can do the detoxification, the medical supervised reduction in their usage in the same facility? So they go to detox, and then 5 days later, they move over to the rehab portion of it, and they generally stay for about 28 days. We take a look at the finances. Could you afford it? Does your insurance cover it? Generally, any intervention services are not covered because, of course, you know, with managed care today, they don't want to pay for anything. So, you know, if you're going to try to attempt to do the impossible by, you know, encourage a loved one to go into the hospital, they're really not too happy with that because then they got to pay, you know, big money on the hospital, and they got to pay big money to the intervention. Well, it's dress rehearsal. Pick the order. Who's going to start? Who's going to set off the intervention? So we take a look at, who's of the 6 or 7 people that we invite, who would be the first one to initiate the beginning of the intervention? Unbeknownst, of course, we're just role playing this stuff. We get the set order. Generally, we want the people who are like a spouse, a partner, to be last. They have the most weight, and we want them to be last. So in basically in intensity order, you know, we'll go around the room and I'll read you a couple of things in there. And this is a book called Intervention. They'll take you step by step on all that I'm saying and all that I didn't have time to say, by Vernon Johnson. He's the godfather of the intervention. And it used to be back in the 70s, you know, the belief was an addict or an alcoholic had to hit bottom in order to wake up enough to do something about it. And we realize now that that's an inhumane thing. We would never do that with cancer and watch somebody's cancer progress when we know that we have the ability to help them through. whatever they're going through. So intervention was a process that was developed and practiced and became, standard. So we have that. This is another book, A Good First Step. It takes a look at the consequences, it's a workbook that someone will take a look at the consequences of their drug and alcohol usage in about 7 or 8 major life areas. I suggest that codependence enablers, we're going to talk about codependent enabling. Emmett Fox, Round the Year with Emmett Fox, it's a daily meditation. Yes, it does focus on some form of higher power of some, it doesn't have to be a religious higher power at all. And they're pearls of wisdom here. Living sober, very basic stuff that is helpful for the addict and alcoholic. And the big book of Alcoholics Anonymous. Okay, I'm going to leave these books with the director. I'm going to take them home and ask the director of the library. I would like to donate these books and see if they will be gracious enough to accept them, so you can come in and take a look at it. And I'm going to pass these around now. So if any of you all want to just take a peek, take a screenshot of them. Okay, so.
And Carl, we'll make sure all these titles get out on the NAMI.
Yes,
website.
very good, very good.
Yes.
Very
Fine.
Okay. I'm going to give you a little bit of a script about how what people are saying when they write their letters to their loved ones. And I'm going to say this as well. If you could allow yourself to get rid of your anxiety, to forgive in some way all of the behavior that these beautiful people who have been suffering miserably, caught in a trap and can't get out, have their conscience has been anesthetized. If you could have the compassion before you go into an intervention like this, I want you to do that. So I want you to look at these books. I want you to study up. I want you to read about it. I want you to get on AI and take a look at all of this stuff that's written. If you could have the children, right? Now, we don't want the children in the actual intervention, but there's generally not a dry eye in the room when you have the kids come in and they talk and they say, I love my daddy, but you know what? I don't know if he loves me. He drinks and he falls asleep and he drives drunk and he, and I'm very scared when he drives drunk. And I know my mommy tries to tell him to give up the keys and he won't, and he argues with mommy and all of that stuff. And it makes me very sad and I cry and mommy just can't seem to do anything about it. And mommy doesn't drive. So the only way we're able to get around is when daddy takes us in the car and you know what? Daddy hits mommy sometimes and he doesn't take me out and he promises to take me out and sometimes he disappoints me. So we don't want the kid to come in and then hear all of the rest of the stuff that us big adults are going to kind of help the addict or the alcoholic to get in touch with. We're going to say that in a loving way, but we could get the kids on video, okay, and show it or have the kids write a letter that could be presented to dad and during part of the intervention. And there are some private things that perhaps some of the members of the intervention team are not going to want to say in front of the other members of the team. So we could have those people step out. And if the spouse, let's say, or the partner wants to say something that is private and, and perhaps embarrassing, right, then the rest that could be said privately. Okay, but it's important that that stuff gets shared in a loving way, in a non-judgmental way, but it's really saying, hey, it's impacted you. I'm afraid for you. Your health is going down. Emotionally, we've been at odds with each other. The kids are scared to death. And so that's it. Plan B, because we're then going to present and you know what's going to happen? He's going to look up at the sky and blah, 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 and blah, 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 and he's going to want to leave. He's going to walk out of the room. So that's why sometimes an interventionist is helpful to like take charge of that and kind of all of that stuff. I've had people run out, you know what I mean? Now I can't put my hands on them, but when I know there's a difficult case or it's a co-occurring disorder case, that I've hired, friends of mine who were in law enforcement, and they're there just as a support, that no one's going to get hurt and no one's going to put their hands on it. But when the person knows, like, Carl's a big guy, I'm a sweetheart, and a little baby inside, but, if I'm 6'5" and I got my boy who's, 6'8", I might get a little bit more respect and attention. So plan B is you also, ask the family members in the event that he says no, or she says, no, I'm not going. Screw you all, blah, blah, blah. Okay, what are we going to do? So plan B can be, if you don't go, I will pack my bags. I can't stay in the house with you any longer. So if we have your bags packed, and I suggest that early before an intervention, bags are packed, they're in the trunk. You don't want to drive your loved one in the car to the intervention location. You want to hire someone, a professional driver, something like that. You do not want to take that chance because we don't know what's going to happen. They're going to panic, and they're scared, to death. And they're going to try to either run or deny, or oftentimes they'll say, I'll go next Tuesday. I got stuff to do, and I got blah blah blah, and I got a busy agenda at work. Meanwhile, the employer is there saying, I'm going to terminate you if you don't go. Plan B is, if you don't go today, now, this car waiting outside, we already made arrangements, finances are done, the staff is awaiting your arrival. If you don't go right now, I'm packing my bags. I'm going to start, I'm going to look for an apartment. I'm going to live with my mother for the next night. You take your time and you think about it. Okay, I love you, right? I'll never stop loving you, but I can't live with you, and I have to take the children because I have to do what's in the best interest of the children. So blah blah blah. Screw you. I'm going to blah. I'm pulling my attorney. You can't take my kids from me. Blah blah blah. We hear this kind of stuff. All of this bravado comes out. The employer might say, if it's, let's say they're in business together, private venture, and the partner is there because maybe he's the one who called the intervention. It's like, I can't, you violated every, agreement that we had business-wise, and I can't continue on. So if you don't get some help, I think you're a great guy, and I think we did great business back in the day, but it's progressed to this point. So we're going to have to dissolve the partnership and blah, blah, blah. So now you're playing plan B, you're playing hardball. And that generally rings, right? I've had spouses who said, I have already called an attorney and I have already put the divorce proceeding in motion. I will call it back. I want you to go to treatment. I want you to prosper from treatment. I want you to continue on outpatient treatment. I want to know, and once I feel like, you're back on track, rip up the paperwork. That generally needs to be in the mix there, because they're gonna maneuver out of it, and there have been times where you've got the patient in the limo, and we're heading towards. You know what the guy says? He says, "What took you so long?" Because they know at some deep level they're out of control. They're too sick. They're too sick to just take the next step on their own. And they figure, well, if the alarm was really going off and I was really in that danger, everybody would have made sure they put an end to this and whisked me away. So sometimes this could go on for 4 or 5, 6 years. Sometimes it can go on for a lifetime. Sometimes people will never, and people die, and marriages end, and partnerships get dissolved, and kids don't want to talk to their fathers or mothers anymore. And it's a terrible thing. All right, so let me see if I could just give you a flavor, because I know we're at the end here, and I really need to organize better or speak for longer. So, and nobody wants that. Nobody wants that. All right, so let's see if we can take a look at something here. On Monday night, you told me you'd come home straight from work. Instead, you came in at 1 a.m. and slept in your clothing, which smelled of alcohol. This is going around the room with. Last week, I came home to find the children outside by themselves. You were asleep on the couch, and there was an empty bottle of liquor on the floor beside you. The children were hungry and frightened. Susie said she tried to wake you up and couldn't. You lost the car twice last month. after you'd been out drinking, I had to drive around the parking lots trying to find where you left the car. When you picked us up from school, you drove so fast, me and my friends were scared, and you said a lot of things that didn't make sense. You promised to come home and play to my class play, and then you told me to shut up. You promised to come home to my class play, then you got sick again, and I was really disappointed. Sam had to cover for you on Tuesday when you didn't come back from lunch until 3 in the afternoon. When you did arrive, you were slurring your words. At the office party, you had 4 drinks in a row and then spilled your 5th all over somebody. I was embarrassed for you and worried that you might lose your job. Okay, so these are some of the things that need to be said. You're not making judgments, you're saying factual information. So let me get 1 or 2 more. Well, you get the picture. You get the picture. And I'm out of time. So I'll tell you what this is. This is the teddy bear that I bought my son before he was born. Okay, and he loved it dearly, and we still have it. And he's 35. My other son was 33. Okay. Wilson, if you've seen the Castaways with Tom Hanks, okay, this was Tom Hanks' higher power. Okay, and a lot of times, you know, what works best for most is we encourage people to go to AA meetings and all of that stuff. The problem is that you go on AI and you ask about AI, about AA, it says that they're losing their audience. 10%, 20% dip in membership to AA. Number one reason is that there's too much talk of a higher power or this God thing. Okay, so what I want to say is, when my father suicided, okay, and I was old enough to understand this God stuff, I'm thinking like, what the hell kind of God would allow this to happen to a young boy? We were poor, living in the South Bronx, moved into the project. Who the hell, what kind of God could this be? And then I'm going into the Vietnam War. I'm going to die in the war. I still don't know what the war was about, even then. Right. So I was going to die on the battlefield. What kind of God would allow all of this kind of stuff to happen? So at 20, when I went to St. Vincent's Hospital, a great teaching hospital, I had plenty of mentors there. Whoops. They said, I sat in every AA meeting I could. I got every lecture I could. I acted as I wanted to soak everything up and learn. I sat in an AA meeting and they said, the God of your understanding. And then the counselor said, G-O-D, good, orderly direction. Screw the religious stuff, screw the moral stuff, all that kind of good, orderly direction. Or G-O-D, group of drunks, G-O-D. Heard the other day, great outdoors, G-O-D. So it's a bedtime story. I want to go right lowest common denominator. I tell myself a bedtime story. I say that I never heard my father tell me a bedtime story. And if I could believe that there this template or this metaphor or whatever, this fable or fantasy of some kind of a loving father, a collective, I'm your brother, and we're brothers and sisters from a collective father of sorts, why wouldn't I adopt that as just a little bedtime story to myself and say, someone's looking after me, right? If my child was in a thunderstorm at night and was, Daddy, there's a monster in the basement. There's a monster under my bed. Sometimes there really is a monster in the basement. We heard that recently in the news, right? But it's like, honey, it's okay. Daddy and mommy are here. Okay, we're going to protect you. You know we love you and we have a good alarm system and blah, blah, blah. Daddy's got an Uzi under the bed. It's all good, honey. It's good. Right, don't you worry about a thing. We're looking after you. Now, that child is going to go back to sleep thinking like, all you got to do is knock on the door, Daddy and Mommy are there, right? It warms their heart. This warmed my child's heart, okay? Wilson warmed Tom, the character, it warmed his heart. Was it his God? I don't know. It kept him alive. He needed to talk. He needed to be connected. He needed a connection. He was totally disconnected. He was going to give up. and died. It kept him alive. And when he had to make a critical decision about the ball drifting off, and as Will said, well, he's yelling at Wilson, it was life and death there. He had to save his own life by allowing Wilson he integrated Wilson long enough to stay alive. So why I'm saying this is that if you're going to do a loving intervention, I'm telling you that, you got to open up your heart. And why I'm late in this thing is because I'm not enough in my head. I have a combination of the head and the heart. And when I do what I do, I have to have an interaction between the two. If I was just cerebral, I would have had a deck and we would have been done 15 minutes ago, asking all sorts of questions and all this. But I'm a little wacky, okay? But there's a place for me in the world with the wackiness, but I have an anxiety disorder. So you know what? Heather said, hey, do this talk a month and a half ago. I've been nervous for a month and a half. Right? If you're told at 5 years old, you know what I mean, that you're the man in the family, take care of you, you're going to feel pretty damn inadequate for the rest of your life. So I feel inadequate. However, I push through it. I push through it and I tell myself some bedtime stories like I could go to the higher power, could be the universe. I was up, the sky was so clear the other night. I tell myself a bedtime story that if I believe that there's a collective father that's going to be proud of me, because I don't have a living father to be proud of me, okay? If there's a collective father that's going to be proud of me and it's going to keep me safe and it's going to keep me pushing forward, not looking back, not like turning back, not backing down to give me the strength to go forward, that works for me. You're not going to see me in a church, maybe Christmas Eve. You're not going to see me in a church. But I don't have to feel guilty about not being there on a Sunday because I have that higher power in my heart. I'm not saying anything for you guys, whatever. I don't want to push anything on you, but I'm telling you that this is what kept that mentally ill, anxiety, traumatized kid from jumping off the roof. And I went to that roof where he jumped and I looked down and I said, I want to fucking live. And I made that decision. Right? And I had to work damn hard at it. Okay, enough for me. What do you think about it? All right, so we're out of time and they got to get out of here. Can I answer one question? Two while people are kind of moving out?
Questions from the room? I'm going to see if we have any questions online.
Thanks, Tom.
Thank you very much.
Thank you.
This may have to save my life.
Couldn't have done it without you, Pat. Couldn't have done it without you. 3 years ago.
No questions.
God bless.
People be healthy, wait for.
God
For
bless.
sharing that. Thanks, Carl.
Yes, sure.
Couple of questions.
Yeah.
One is. How often do interventions work?
Okay.
And the second is, how does it differ when there's a dual diagnosis, when someone has a mental illness and lacks insight into their
Right.
condition?
I can give you the statistics. I've done hundreds of them. Okay. When the goal was to get the client into the hospital, I missed twice. Twice. Not because I'm great, because the process is done out of love. I'm on my knees before an intervention. I prepare the people well. They're ready. They're scared to death. When they get strong enough, then we proceed. Right? When they first come, they're not ready to do it. You know, they're not ready to do it. So I can tell you that the process works. And I can tell you this, the proof is that, you know, I'm 70 years old, having done this for 50 years, and I'm not burnt out. And I'm hopeful. And that's why I wanted to do, you know, this talk, because I'm not ready to, you know, throw in the towel yet. I want to get out to more people and encourage them to take it. But I think that this notion of opening up your heart, when my heart was dead, my heart was broken, my father jumped off the roof, my heart was dead and God was dead. It was not, right. It took me to open up my heart. And I think that most alcoholics, we commit so many sins under anesthesia that I used to say, I hope there's not a God, because I'm definitely going to hell. Definitely going to hell. So things change when I realize that it's the God of our understanding. And I got that not from the priest or the synagogue or the rabbi, I got that from people talking in AA meetings. So When there's co-occurring disorders, yes, you have to be careful. People need, specialized treatment. They need medication. If there could be a psychiatrist on board, at times that you might have to call for EMS. And you have to be careful about, you can't take a child or anyone across the state line. So if I'm in New York and I wanted to send somebody to Silver Hill Hospital, let's say in New Canaan, Connecticut, I can't cross the state. So there has to be a lot of, upfront, ahead of time, planning about this. It's difficult, but they go. They go. They go.
I have a question that came in from someone online and which it is one that we encounter all the time in NAMI. And that is what's the difference between, don't fall. What's the difference between helping and enabling?
Right. Wanted to get to that.
It's,
So we'll just go on for another 2 hours, okay? You'll stay,
Yeah.
right? And just give me more food. Okay, enabling means when I am drunk and I park my car on David's lawn and my wife says, oh no, I'm not gonna be the talk of the town. I'm gonna go take that car off the neighbor's lawn. Okay, because she doesn't want to be humiliated. She doesn't want humiliation for me and by association, certainly for her. So she'll take the car off David's lawn and put it back in my driveway to spare me. That's enabling behavior. That doesn't allow me to kind of get connected to the consequences of my behavior. And this is easily done all the time. We love our loved ones and we don't want them to be embarrassed and humiliated. We don't want legal trouble and all of this kind of stuff. If I'm drunk and I call in I want to call in sick, but I'm too inebriated, I'm slurring my speech, and Pam says like, honey, I'll call you in sick, but I'm not going to do it anymore. So she calls and she tells my boss that I have the flu or something like that. That's enabling behavior. If I feed my kids money because they don't feel like they need to go out to work, and they are living in the basement, they need money for weed or they need money for this, and my wife gives them money without letting me know, she's enabling them. I don't want, no, let them go through withdrawal. Don't feed them the money. Now, if it's opiates, I don't want my kid going out on the street and getting fentanyl or getting arrested. So I, the mother, am going to go out and cop, these are real life stories, right? I'm going to go out and cop the stuff for the kid. I don't want to, right? Then the kid says, Mom, this is classic. Mom, I owe the dealer money. They're going to kill me. They're going to kill me. I can't tell you. That is an epic line. They're going to kill me. Okay. So what mother wants to hear, you know what I mean? My son is going to be killed by the drug dealer. So honey, we're going to go to the bank and we're going to ask relatives, you know what I mean, for the money. And all of this kind of stuff is like, you know what? That's enabling behavior. It's done out of love, but it doesn't allow a person to hear the consequences of their behavior and face the consequences of their behavior, which would actually wake them up. That's the thing. So you want them to hit a kind of a bottom of sorts, not enough to kill them, but just enough to wake them up. But you want to do it in a loving way. You have to stop the enabling behavior. And in Plan B, if the mom says, "Listen, you can't live here anymore. We're gonna give you a month or two, and then we're gonna help you to get an apartment, and then we're gonna just get you settled, and then we're gonna back off, and then it's up to you. You're gonna sign the lease. We're not gonna sign the lease. Well, we'll give you the first month's rent. And you have to get out of the house. You need to get a job. You need to get out of the house, and we're not going to do anything. I love you, and I'll worry about you all the time, but I can't. I've learned too much. I've been to Al-Anon, and I suggest that you all go to Al-Anon meetings and go to open AA meetings too, and understand from the alcoholic's perspective what they're going through. I tried to give you a little bit of that today. Get educated. It's counterintuitive. What's going to help your loved one, it doesn't come naturally. It's counterintuitive. And it's not easy to do what's counterintuitive. So you need support to do that. Power greater than ourselves doesn't mean spiritual. It just means come to a place like NAMI, get involved, listen to all the lectures, make sure they end on time. So, thank you all for coming.
So much.
Thank you for putting up with my inability to really structure this well, but I wanted to give you enough of a rounded out understanding of what you're up against and what your loved ones are up against. They're only trying the best that they can and they're scared to death, and so are you. So ask for help. And if you could, tell yourself a bedtime story, I think that's the way to go, because that's what got me through. That's what got me through. And I'm not done yet. So, all right.
Thank you, Darrell.
Thank you for asking me to meet.
Thanks to everyone who was online.
Thank you so much, Carol. I